What's up, everybody? Welcome back to another episode of Health Made Easy. I'm your host, Dr. Jason Jones, and today we're going to be talking about how alignment or correcting the alignment and soft tissue work helps correct TMJD or temporomandibular joint dysfunction problems with your jaw. Now, if you got pain or you experience some sort of clicking, popping sounds in the jaw, you may be suffering with TMJD. Now, we all have a tendency to experience this pain, but you don't have to live with it. There are natural, non-invasive solutions that work like magic. We've been doing them for a very, very long time in our office. Not every chiropractor does this. As we talked about on many podcasts, there are levels to chiropractors, just like there's levels to dentists, there's levels to surgeons, there's levels to restaurants. There different training, different fields of focus, if you will. But we've been doing TMJD work and TMD work for a really long time. And really what we're looking to do is help with the alignment of the jaw if that's off, but also the soft tissue to help loosen up the jaw and relieve pain, but at the same time make sure the jaw is functioning as close to back to normal as we possibly can. The interesting part is that the chiropractic procedures that we use are very quick, they're very fast relief, and we notice changes pretty much immediately when we start doing them. But correcting it over the long haul takes some time, for sure. Now, TMJD, also known as temporomandibular joint dysfunction, which we've talked about that before, is a term described for acute or chronic inflammation in the TMJ in the joints, which again connect your jaw to your skull. And TMJD is often described as like a wide variety of conditions, everything from conditions that affect the joint, the facial nerves, and even the jaw muscles. So this joint dysfunction is common among younger people, and it can be caused by a number of factors, including teeth grinding, trauma, direct injury to the jaw, degenerative joint diseases, such as arthritis and autoimmune diseases. And most times, TMJD is accompanied with an ever increasing wider range of symptoms, including things like headaches, ear pain, neck pain, jaw pain, when you're chewing or biting, tinnitus, which is like ringing in the ear, jaw stiffness, difficulty opening and closing the mouth. Sometimes it gets stuck open. And if you experience any of these symptoms for a long period of time, you definitely are probably experiencing TMJD, and it is really advisable that you take some quick action and get some help from this. But you got to find a provider that can actually do this. Now, how a chiropractor can help with the alignment and soft tissues of TMJD. First thing I want to say is that all TMJ issues, even dentists recognize this, that they almost always come with problems in the neck. And if you do not clear the neck first before you start to work on the TMJ, the results will not be as good. Okay. The chiropractors are certainly experts at, relating to the spine, relating to the nervous system. At our office in Elizabeth City, North Carolina, we worked on a number of TMJD cases and help our patients get relief from chronic pain and symptoms associated with this condition all the time. Now, I can only speak for our office, but when you visit our office with the jaw pain, we're going to focus on some very key muscle factors as well. There's the masseter, which is like right on the outside of the jaw. You have the pterygoids that are like deep up in there. You also have the temporalis, but then you have other muscles around there, or what we call muscles of mastication, which help with chewing and everything when you're eating. But we also work on like the suboccipitals, which are like muscles underneath the base of the skull. The top two vertebrae for sure, which are like some of your more common culprits. But you also have to look at the lower part of the neck as well, because it's all interrelated and it's all interconnected. So the masseter is like this really thick muscle in the upper jaw area that controls like the chewing. It like gives you that bite down strength. Your temporalis is kind of thin up there, kind of around on the side of your head, and it also controls chewing, but covers a broader area than I would say the masseter does, including the regions around the temples. So what we do is we just walk you through some soft tissue techniques that work not only on the masseter and the temporalis to relieve jaw pain. There's actually 5 distinct points that we work on. and doing that. But after we do the soft, the adjusting part of the jaw and or the neck, then we do the soft tissue work, okay? And then we reassess the joint to see if it's tracking better and aligned better. And most of the time, we see really fast results with it unless it's just been there for a really, really long time. So I hope this helps you out. I hope this makes sense. If you're somewhere listening to this podcast and obviously you're not in our area but you need some help, look for a doc that does very specific TMJ, TMJD, TMD work. And we will see you on the next podcast. Bye-bye.